This week's seminar is by Kenda L. Sutton, and without any further ado, I'm going to, on behalf of Adrian Fu Berman and myself, Adrian is the other co-director of the program, introduce her via Yoretzi Polanco. So Yoretzi was a student in our program last year and also did a capstone project with Kenda's organization. So welcome back, Yoretzi, and welcome, Kenda. So Yoretzi.
Yeah, thank you for having both of us. Without further ado, I'll introduce Kenda. So Kenda is the founder and executive director of Birth and Color. So she's a native of rural Virginia, and she focuses on reproductive sexual justice, birth justice, Black maternal health, structural racism, and advocates for incarcerated pregnant people and human rights violations. So she conducts trainings for people of color to become doulas, as well as provides racial bias training for healthcare professionals. And right now, Birth in Color is the leading organization in Virginia that focuses on the care of people of color and the implementation of doulas in the workforce. As the chair of the Virginia Doula Task Force and chair of the Greater Richmond Regional Maternal Child Healthcare Task Force and member of the Virginia Maternal and Data Outcomes Task Force, Kenda is influential in shaping maternal health policies. So she has participated in Vice President Kamala Harris's roundtable discussion on reproductive health and co-founded Black Maternal Health Week in 2019. She has also led the campaign for doula Medicaid reimbursement in Virginia, and her dedication to reproductive justice has earned her numerous accolades, including being a 2019 Game Changer nominee, creator of Her Story with Urban One Radio in 2020, and the recipient of Woman of the Year, along with other nominations she has received throughout her time with Birth in Color. In 2024, Kenda was honored with the Health Equity Advocate of the Year by Families USA, highlighting her significant contributions to maternal health. But overall, Kenda's greatest pleasure as a reproductive health worker has been watching women become confident and excited about birth and early parenting of their children. And she firmly believes in the power of redirecting your fears and anxieties into finding a new empowering way to experience birth and parenting. And a fun fact about Kenda is that she also has a twin brother. So there's she has that as well. And I'll go ahead and let Kenda continue.
Thank you so much, Yoretzi, and thank you guys for having me here today. So we're gonna do this a fun way. So I'm gonna present and I'm gonna go through certain slides, but at any point I want you to be able to like raise your hand if you have questions, if you have any comments at all. You can definitely raise your hand, jump in, talk to me. I'm one of those people that don't want to feel like I'm talking to myself. And so I'm always pride myself in trying to be a great presenter to where it's not boring. I'm not putting you to sleep. So definitely feel free to ask any questions that you guys have. And I'm going to share my screen. All right, so Birth in Color. We are bringing cultural inclusivity to the forefront of maternal health and reproductive justice. And so what you will learn about our organization is you'll learn about reproductive justice, community resources, our doula collective, and policy advocacy, and what sets us apart from other organizations. So Birth in Color is a Virginia-based nonprofit that focuses on the values, intersections of reproductive justice, cultural competent maternal health, and the celebration of people of color. A lot of times you'll see where people will say, oh, the underserved community, or, oh, it's a lack of access and all of the things. But what we want is we want to celebrate people of color for where they are and try to make sure that we're encouraging about, hey, you know, this is a health disparity. You are at risk. Certain things that you might not have learned, we want to make sure that we're educating our communities. We have a theory, which is called the color theory. And this is our organizational pillars. And so color essentially means cultivate change, observe with care, listen actively, optimize outcomes, and build rapport. And so when you think about cultivating change, it means really guiding the journey by actively fostering positive transformations in the birthing experience. So how can we actually create change in the disparities? How can we create change in the infrastructure of what has been created for us in the past? And so I really wanted that to be a real strong pillar as it relates to the work that we actually provide within the state of Virginia. And then observing with care. A lot of times you'll hear about all of the disparities, specifically Black maternal health, which Black women are 3 times more likely to die during childbirth than their white counterparts. And so I wanted to take providers back to the basics. And what that essentially means is instead of focusing on the surveys and all of the things that have been created for providers to do a checklist, I want you to like take a moment, observe with care, observe the patient's behavior, observe what they're actually doing, because that could tell you a lot about a person. Observe wherever if they're complaining about a womb, observe like what's truly going on with the womb, like take a step back. And then you have listen. Actively listening is really, really important. A lot of times people will listen to respond instead of listening to actually hear what someone is actually saying. And so if we think about people coming to us and saying like, hey, I have a concern, instead of pushing them away because what we have been taught, instead of like saying, oh, well, Black women feel more, have a higher pain tolerance, so you're fine. Actually listen to what the patients are actually saying, because that can give you a different perspective on what's actually happening. Optimizing outcomes, elevating every birth by dedicating ourselves to enhancing and ensuring valuable outcomes. And so if we want to see true outcomes change, we have to be able to go back to the pillars. And the last pillar is R, which is build rapport. If I build rapport with you, you will begin to trust me. And that's when you're going to tell me certain things about yourself that I may not have ever gotten from you if I don't trust you. And so how can we build trust with our clients? We realize that most providers only have about a 15-minute window with them, but once you have that rapport, it changes what the amount of things that you can actually obtain in a 15-minute window. And so, for instance, if you told me that your child was going to college, and then you come back 3 months later, if I notated that on the chart, I can ask you, hey, how's your child doing that's in college? And that is going to make you feel like, oh, she was actually listening to what I said. She actually truly cares about me. And so building rapport can be a quick way. And that way we can help change some of these disparities as well. Reproductive justice. And so a lot of times people are like, what is the difference between reproductive justice and reproductive freedom? And so the reason why we say reproductive justice is because it's the human right to maintain personal bodily autonomy, to have children, to not have children, to parent the children we have in a safe, sustainable community. Our organization focuses on reproductive justice because it intersects with everything. It intersects with climate change. It intersects with environmental justice. It actually intersects with marijuana justice. It intersects with housing. And so when you think about the framework, a lot of the framework will tell you how to intersect with different ways. And so we change policies based upon the reproductive justice framework. We go to legislation. How many of y'all actually listened in civics class? Because that's going to matter if you ever want to change a law. Most people think that the president makes all of the rules in the United States, and that's not true. The president can only do what Congress allows them to do. And so sometimes when we think about what a president has not done or not accomplished, we have to look at who we're actually putting in office that's in Congress, because they actually hold a lot of the power as well. And then there's only so much you can do with an executive order. Even on the state level, when you think about the governor, when you think about your mayor, you have to think about who are you putting in city council? Who are you actually putting in the General Assembly as far as senators and delegates, because they're the ones who have to vote on these things to pass. And so I spend a lot of my time developing policies and advocacy and looking at what other states are doing that could actually help us to thrive, help us to figure out what do we want to see? How can we actually have some real change? And so that's a very pivotal part of our organization is the advocacy component. This right here is the community resources. Out of belief that those who want to have children should have the right to parent those children well, we offer numerous community resources, including free classes, support groups, many free and low-cost services to our clients. We have things like childbirth education, lactation support groups. We have a huge fathers initiative where we actually promote self-care within fathers as well. And why that's so important is because sometimes fathers are not celebrated. A lot of the times they're just looked at as the provider. They'll get shushed in the doctor's visits. No one is asking them how are they thriving, what does their mental health look like. And so we want to make sure that we're celebrating everyone no matter what their role is, and we're educating them on how their role can pivot and the different things that they can do that is going to be a part of the journey. We have breastfeeding specialists, we have abortion doula support, and we always have things like community baby showers, which are called our color carnivals. And there's just a huge celebration of it's carnival style, but it's all about promoting health and wellness. And so we try to think of creative ways to engage our community to make sure that they are part of what we're actually doing. And here's more about our color carnivals. This was from this past Black Maternal Health Week. And as you can see, it's truly a carnival style. We have cotton candy, bounce houses, we have DJs, so we dance, we like to have fun. Because when you're promoting health and wellness, it's always important to do it in a fun way so that people are actually retaining the information instead of just saying like, oh, this is another push me to do something that I don't want to do. So we always try to make sure that we meet people where they are. Birth in Color Summit. Every year we have a Black Maternal Health Summit. We have powerful speakers, insightful speakers, and valuable discussions. We talk about any and everything, and it's all a safe space. So every provider who comes, like, this is one of the reasons why it's not recorded, because we allow them to be themselves and they're not representing any type of hospitals or any doctor's offices, because we want them to talk about their true experiences and what they're seeing from their lens. And so this is something that we've done. This upcoming year will be our 7th year. And every year it gets better and better. And so this is one of our prideful things that we actually do at Birth in Color. And so with our lactation program, which is called the Breastfeeding Project, it actually addresses systemic barriers. It promotes healthy parents and babies. It trains specialists of color, and it provides free support classes to the community. And the reason why we want to address systemic barriers is because I'm not sure if y'all are familiar with like what nursing or anything historical, but for a long time, Black women actually fed their slave masters' children from their breast. And so in our community, it was always like said, oh, some people would breastfeed, and then some people like, I'm not doing that because I don't have a master anymore. And so we wanted to make sure that we're educating, like, breast is one of the best things that you can actually give to your baby, breast or chest, lactation, human milk feeding. And so we wanted to make sure that we're addressing those concerns and we're educating on, hey, this is why it's important to do this. If you're having complications, how can we assist you? How can we promote that it's healthy? How can we change those disparities where Black and Latino women are the lowest that actually successfully breastfeed children until the age of 1? And so this is why this project was so important. This is our father's class. And as you can see, I love to do fun things. The middle picture is the blueprint. And as you can see, the dads actually have on the empathy belly. And what you don't see is that they have on a contraction simulator also. So they get to feel a little bit of what it feels like to have contractions. And every time I can only get to level 3. So I always say, okay, if you now you get to empathize, now you get to have sympathy for the birthing person to encourage and to realize that you can't fill those shoes when it comes to birthing. And so they start to have a lot more respect for the pregnancy journey and make sure that they're actually checking in and realizing that we're just not complaining. We're actually going through it as carrying a whole nother human inside of us. And so that's one of the fun parts of my job is what I get to do. And then from on the left, you get to see childbirth education. And so what you see in this picture is a rebozo that the doula is actually holding. And so we're showing them different ways that they can take pressure off of the pelvis area, different ways that they can actually comfort themselves through that journey. And then, of course, we created postpartum boxes that are specifically for dads. We do have them for moms as well. And our doula collective, Birth in Color has trained over 250 doulas across the whole state of Virginia. We have about 160 doulas that are still active community doulas, and 40% of our doulas are actually Medicaid certified. And in the state of Virginia, if you know anyone that's expecting and they have Medicaid, Medicaid does cover the cost of doulas. And this is our annual birthday party that we actually had, and we were at a simulation center right outside of Lynchburg that they got some hands-on additional training. And so what is a doula? A doula is a non-medical professional that provides compassionate care, provides advocacy, knowledge, information, and just make sure that everything is going good in providing different resources when it comes to childbirth. And the doula project. So we train doulas, we empower doulas. We have a whole day that's dedicated to self-care of doulas. Most of our doulas actually do have to do doula debriefs, which they meet with the mental health person to debrief about what was the birth like. Was it traumatic? What were you thinking about? Do you feel like the person needs more additional resources? And the reason why we do that is because we never want our team to be burnt out. We want them to really be able to continue to pour. And so I'm a big self-care advocate. Even when it comes to the students who come here, we make sure that we actually have days where it's fun. We make sure that we have days where it's like, okay, just go take care of yourself. Whether it's go get a massage, go get a facial. We have different days that are dedicated to that because no matter how much we continue to pour out or what the work that comes along, we have to remember that we have to censor ourselves as well, because that's going to be important on how we go along and so that we don't get burnt out. And then we have a huge community impact. We never do anything or create a policy that the community did not ask for or that the community does not want. And that's why Birth in Color has lasted so long, is because we truly have the back of the community. We truly ask them. We truly try to make sure that whatever we're doing, it's beneficial to them and not harmful. Even when it comes to, like, a lot of times universities will reach out to us to be a part of a research project after they've gotten the research grant. And so a lot of times we will refrain from working in those environments because we really want to make sure that the community is taken care of. And so if we're getting data and we're getting information from the community, they need to be heavily resourced for giving out their information, because that's how we all get to thrive in the work that we actually do. And this right here is more about our advocacy. Our mission is to making lasting and impactful change in reproductive justice in Virginia. It cannot be done without intentional efforts at the policy level. Birth in Color advocates for policy that protects and provides more resources for families in Virginia. Whether you want to have children, whether you don't want to have children, whatever that journey looks like, we want to be able to support you. And so this is another picture from our Advocacy Day, which we always have a Black Maternal Health Advocacy Day in the month of January, when General Assembly is starting up. What sets us apart is that we have cultural awareness, high quality training curriculums. We have statewide services, so we cover mainly the whole state of Virginia. Whether we have a couple of people there or a little bit, we're trying to make sure that we do cover the whole state. And then we have a lot of community events and resources. Our community, since our founding, which was in 2018, we've empowered the lives of numerous Virginians and engaged a diverse audience as a result. Our community serves as a crucial conduit for shaping the future of reproductive justice. And this is just all of the people that we do serve and that we do participate or that do volunteer with us. This is a review from a client. My doula was there doing my entire experience and supported my choices every step of the way. She created an excellent environment for me to give birth, and I loved it. Let's talk. This is our social media page. On all social media platforms, we're Birth in Color. We try to make it too difficult. Our website is Birth in Color. And so what questions do you guys have?
So Yuretsi is going to be moderating the Q&A for you, Kenda, while people gather their thoughts after this really wonderful presentation about some great work that you're doing. Let me just ask a question to get things rolling. So what has your organization done in the area of prison justice and both in terms of advocacy and maybe even care, although I know that might be kind of difficult?
Oh, so actually, if you're familiar with Arlington Jail, we have a doula program inside of the jail. So if there's a pregnant person who comes in, we actually get to be in the room with them while they are having their baby. We get to meet with them to make sure that they're educated. We changed all of their policies around the jail as it relates to breastfeeding, picking up milk. We also changed the policies when it comes to nutrition and the meals that they actually are getting, because we wanted them to not just get peanut butter sandwiches every single day as their snack. So I went in and I was like, hey, how would you feel if you actually had to have a peanut butter jelly sandwich every single day, and that's the only snack that was different? And just tried to make them see it from a nutrition level. Also, is like there's other things that have a lot of protein and are healthy that we could be offering that actually has that's even cheaper than peanut butter and jelly. And so that's what we did. We actually trained some of them. If they're low classification, we'll train them to actually be doulas so that they do have a way, once they're a part of their re-entry, that they do have a job that is waiting for them and that they can kind of like get on their feet. And so that's a lot of our prison advocacy. We set up a work group for all of the jails across Virginia, where we came up with new policies about when a client just comes in, when a incarcerated person comes in, how can we actually do a pregnancy test within the first 24 hours? How can we get them seen by medical? How can we screen them for mental health? What is that actually looking like? And just trying to make sure that we realize that people still have human rights no matter what setting they're actually in. And so that's that's one of our most prideful things, is working with Arlington Jail to make sure that program was up and running.
Fantastic. Let me turn it back to Yuretsi after that interruption.
No, that was a great question, Dr. Myers. Yeah, if any students have any questions, feel free to use the one of the reactions or raise your hand or go off mute, and we'll open the floor first to students. And then once the students have asked the questions, we can open it to the rest of the community.
So students, don't be shy. Okay, I see some hands coming.
Go ahead, Francis.
Hi, I was wondering how important, if important at all, it was for your doulas, or if your thoughts in general, like on doulas in general, to have had given birth before becoming a doula?
Oh, great question. It's not important. When we train them, they take extensive training. So whether we have doulas who don't have any children at all, because it also educates them on how to get themselves ready for when they do decide to have children, but also with the information and the knowledge that we give them, they're still able to support someone who is birthing, even though they haven't. And so they get to learn, they get to be a part of it. And then when they get pregnant, they're like, oh my gosh, now I know what my client was feeling. But we don't have, even when it comes to clients, they don't care whether the person has had, as long as they did training and they went to births and stuff like that before, then it's not really that important.
Great. Thank you so much.
You're welcome.
We have Mickey next.
Yes, can you hear me okay?
Yes.
Okay. So my question is if you guys, I know you work specifically in Virginia, but do you guys collaborate with other organizations outside of the state of Virginia, or do you guys ever plan on expanding outside of Virginia yourself?
Great question. So we actually have expanded. So we are in DC, Maryland, and North Carolina. But we're trying to decide if we really want to like expand to the whole US, or if we just want to like keep it in the regional area of just the Eastern District. So that is something that we're contemplating.
Okay, Shatana, am I saying that correctly?
Yeah, Chitana. So my question was there a moment in like your life that you realized that this was the work that you wanted to go into, or like kind of just some background on like the inspiration to do this?
Sure. So great question. One of the things, so my great grandmother was a midwife. And you know how when you have to go to births or, my whole family comes from healthcare. So my whole entire family has always been the people that go over and beyond and take care of the community and do all the things. So I always said, like, I'm not going into healthcare. Like, that's not, it's too much time as a child. I had to be the child that was tagging along with my grandmother or my mom to go help a sick person or help someone that was about to have a baby. So I didn't want to do it. So I actually went to school for business management first. I was working at a rehabilitation and healthcare rehab, and my friends started having children. I realized that they were not educated on what they were supposed to be doing. So I started to jump into that role of like, okay, let me do this. Here's the education, all the things. So then essentially I became a doula. And then after that, I started looking at the disparities in healthcare. And so I was like, what is going on? Like, this is horrible. Like, let's figure out a way. So we decided let's create something that is a central location where people can find doulas who look like them, and we can try to figure out how to change these health disparities. And so that's when we came up with Birth in Color. And all that to say, if I had to probably listen to my mom and my family the first time when they said like, oh no, you should go into healthcare. It should be the thing. But you know how like when they tell you what to do, you're really like, I can do my own thing because you're not going to tell me what to do. I should have just listened because then I could have been like so far ahead already. But my journey is my journey. So, but that's the fun part is that I did have the business side of it. So I'm able to effectively run Birth in Color.
Thank you.
Great question. I think we had Hannah next.
Hi, so I had a question about the breastfeeding program. I was wondering what kind of difficulties arise when individuals are breastfeeding and how the program has worked to address those.
Sure. So the difficulties is not being prepared. Most people think that they need to get prepared once the baby is here instead of getting educated prior to the baby coming. And so we've been able to address that with the milk bar, which is a lactation clinic that we have once a month where people can come in. We give them so much education. It's a support group. Even if they are breastfeeding during that time period, then we do make sure like, hey, you want to weigh your baby, you want to see how much milk your baby's actually getting, combating with pediatricians who don't really know a lot about breastfeeding or lactation for that matter. And so just making sure that we're educating them on that side too. And so that's how we've been able to like kind of navigate those things, because there's so much that goes into breastfeeding that people don't really pay attention to. And so we try to make sure that they're educated so they don't get things like mastitis or clogged ducts, or even the lack of milk based upon how they're eating. And so staying hydrated, not eating gassy foods because they'll make the baby gassy. And so those are things that we just incorporated into our program.
We have Abriel next.
I was wondering if Birth in Color addresses the disproportionate rates of sexually transmitted infections in Black women that could potentially affect the baby when giving birth. And when I asked this, I'm thinking about HIV and HSV 1 and 2 specifically.
So yes and no. We've just started to like dabble into that a little bit more and try to create some prep programs and different webinars so that we could do that education. But with the youth, we do that a lot more when we go to the schools and we educate on like, hey, you know, you need to be paying attention to these certain things, because a lot of the sex education when it came to the youth has been dropped. Specifically, when I went to school, it could be raw. And when I go to the schools, I'm like, so you can't say this, you can't say that. So kids don't even know certain things, even when it comes to like oral sex can give you a disease and like different things like that. So that's something that our research team is starting to like dabble into so that we could provide those statistics specifically to people who are like thinking about getting pregnant, or even the ones who are just like now becoming sex ready. But we do have information that we in like handouts and slides for if a pregnant mom does come into the office and she has some of those things, we are able to tell them like certain things that they can and can't do. Specifically with herpes, if there's an outbreak, you cannot vaginally have your baby. Well, you can, but they advise really against it because that will give the virus to the baby.
And we have Michaela next.
Hi, I took a quick look on the website and noticed that there's a form for volunteers, and I was wondering what that kind of would look like and what different opportunities a volunteer would have.
Sure. So we really ask you what do you want to do as far as volunteer work, and we give you the list of all of the events that we have. We tell you all the services that we provide, because some students do come in and like help with childbirth education. Some come and participate with the color carnivals. So we really just kind of leave that up to you all so that you can get the experience that you want to get out of it.
And remember, we've had 2 students do capstones there, and they seem to have done a good enough job that I think that Kenda might consider having someone next summer.
Definitely. We definitely love you, Retsy.
Yeah, I think I can speak a little bit on that. On when Kenda mentioned you can really form and shape the project that you want to do. So like if you wanted to work like with their policy team or specifically, like it's really helpful for you to come in with like very specific like goals of what you want to get out of it. Because they cover so many spaces of birth justice / reproductive justice. So there's just a little call out for capstones and to start looking for them early too. And then we'll have Callie next.
Hi. So I had a question regarding your policy work, and I just wanted to know if there are specific ways that you gathered the information and how you decided, which policy approaches you wanted to advocate for.
Sure. So we host community learning sessions. So we'll take things from the community that they're saying like, hey, this is not working. We'll look at the data that comes from the state. We'll look at the data that's come from the organization, and we'll just put it all on the wall. and kind of determine like, okay, what policies do we want to see based upon what we're seeing from the research, seeing from what our clients are saying. And we love to go by patient experience and let that guide us. And so then we'll take a look at what other states are doing to combat it and then come up with a strategy.
We have Jackson.
Hi, so I have a question about like how does Birth and Color work directly with medical professionals on training and like educating them on these topics? And I guess what do you think is like the best way to educate future medical professionals on like these subjects?
So what we do is wherever our doulas are, we typically have a contract with those hospitals. We share data with them. We share what we're seeing. Like I'll have monthly or monthly meetings with them, and we talk about what we're seeing like real time. And so that just allows us to drive the different trainings and make them realize like, hey, you know, this is a training that your team needs. And we create a safe space. So anything we tell to the hospital or they tell to us, we don't carry it outside, which is keeps us to have that room to say like, oh, y'all definitely need this. But also when it comes to future trainings, we just make sure that they're looking at the data that we're seeing, that they're listening what the patients are saying. And a lot of times when it comes to surveys, they can't get patients to fill out surveys, but we can. And so that we use that as our leverage to be able to go in and to provide the trainings.
We have CJ.
Yeah, I had a similar question about some of the trainings, just pretty much about like the training for the doulas and like what those qualifications are, and then maybe speak a little bit about like the major characteristics or traits you look for in a doula.
Sure. So anybody can take the doula training. Well, let me change that. Anybody could take a doula training. But when it comes to Birth and Color, we do interview people to make sure that we feel like they're a great fit for our clients. And what that entails is, do you really have the time to be a doula? Do you really have the time to listen to a patient's concerns, to be able to advocate for them, to spend time with them, to build that trust and rapport? Do you have a nurturing spirit? Do we feel like you're gonna give them some type of bias? Do we feel like you can recognize your own biases? Because everybody has biases, you just have to determine which ones you do have. And so that's typically what we are looking at. And then also, what's the reason you want to be a doula? Have you done any research on it? Especially during this time right now, the doulas are so trendy that everyone feels like they want to be a doula because Medicaid reimburses for it. But once they get into the work, they're like, we did not expect it to be like this. And so making sure that we're educating them on that level.
And we have Katie.
I was wondering, like, what was one of your most unexpected results? Like, maybe if there was a program that you didn't expect to take off as much as it did, or like a community need that you guys hadn't anticipated, or like the reverse, if there was something that you really expected to be popular and then like kind of never took off.
Sure, great question. I would say the dad's self-care day. It is so popular that we run out of things, we run out of space. And so we just had one in June and we had 70 men show up. And they get like free massages, free facials, free manicures, haircuts. We had a cigar lounge part for them. We had food, all the things. But we were doing like they were so engrossed in it, engaged in it, where they did health screenings, they did voter education. We were able to do a lot with them. And so they send me emails literally every week to check in to say like, when is the next one? hey, we have money, we collected donations, can we make this happen again? And I think it was because they were able to be around other like-minded individuals who were either thriving or trying to thrive, or some of the guys who came didn't have father figures, so they were able to connect with different ones here, that just gave them more motivation and things like that. So people always like, what's your favorite part? And they get mad when I say it's the dads, because they're so thankful for whatever we do, because they're never celebrated. That's what drives me to keep going with the dads whole program, is because they're truly appreciative over anything. And we're, as women, we're not, we find a way to complain about something. And so that's really the most expected thing. Now, when it comes to some things taking off slower, I would say it probably was the breastfeeding initiative. We thought it would have, in the beginning, we thought it was going to be like through the roof because no one was providing that service. But people were so skeptical about breastfeeding that we had to like take a step back to educate the importance of it, the benefits, and all of the things first. And then we went back into providing the services, and now it's successful.
Great question. We do have a question in the chat from the community. So it's Arlene. Here in Wisconsin, we're trying to start a doula program in the prisons, but are facing pushback about the cost and who pays. How did you get it past the VA Department of Corrections and the state legislature?
So when it comes to that is very difficult. So we didn't go through the Department of Corrections first. We didn't go through the state legislature first. So when it came to the state legislation portion, that was just the work group so that we could all come together and talk about what's needed. And that you have to be very strategic in what you're asking for. So when I asked for the work group, they didn't realize like what I was truly thinking about. So when I was able to take the report and the data and then come back to say like, all right, who wants to do this? How could I build rapport? So I built rapport with the people who was on the work group, which are the people that are over top of the jails. And so when I sent out an email to the jails of like, hey, this is what I'm thinking. Who wants to be the first one? Arlington let me know like, oh, let's do it. Like I'm a guy. My wife had a baby. I was present. It was a home birth. Like I feel like it's so important. And that's how we actually were able to get in. So you have to be able to find a way to get in before you ask for money and funding to do something that they don't know if it's really going to be beneficial or harmful to the prison system. And so I would say like your language and your wording that you're using, be mindful and have someone pilot it first, and then go backwards.
And we have a question from Dr. Fu Berman. How is Birth in Color funded? Does the doula training cost money?
So we're funded by grants, donations, fundraising. That's really how we're all funded. The doula training does cost money. And so when it comes to that, but we do offer scholarships for people of color. And usually that funding for the scholarships come from either grants or a state initiative or something that we're a part of.
And community members can also raise your hand as well, or if you want to put it in the chat as well. We have one from Ralph. Can you describe the clearance process in the prisons? What decelerations must you make?
The clearance, I would say I can't, for our program is different. We've really built the trust. So I really had more of a reign in throughout the system than other people would have. Now, when it comes to the policies that we put in place is you do have to go through a background check. As long as you didn't like kill someone or something violent, then you're able to get in. Now, when it comes to training those individuals, because we do know that Medicaid does a background check too, we do make sure that they're low classified. low classifications, which means non-violent at all. And declarations, we didn't really do any declarations. We just had real open conversations.
So I think that means declarations in terms of what kind of declarations are required to get into the system, into the, for someone to enter the facilities, I suppose.
To get into the facility, everyone, as long as you are cleared through the background check, then you can actually get in. And even when it came to picking up the milk, and we designed a system where she actually was able to have in-person contact visits with her baby once she had the baby. That person who came in with the milk and stuff like that, they just had to have the clear bags and, still adhere to prison policies.
Okay, so Yoretzi had to leave momentarily to take care of her toddler. Do we have any other questions from the audience at this point? And at this point, John Grogan, our long-term participant from up north.
Thank you. And thank you for this presentation and your life's work. I grew up, both my grandfathers were predeceased, and I don't have a blueprint or a playbook on how to be an effective grandpa. And I'm wondering if you might consider extending the partner father support to extended family, particularly grandfathers. Thank you.
So yes, actually, we do want any male to come. We just call it the dad's event, but really, when we're promoting it, we do say like any male, any person who identifies as a male can actually attend, because we do make sure that, hey, there's not where they feel like enticed or anything like that. So even my doulas don't even show up. It's truly just a male event. So yeah, we would definitely love to have grandpas, people who don't have children that just want to connect before they even have children. So yeah, anyone.
Sorry, I had to run real fast to get my toddler to the bathroom one time, but I think I missed out just a little bit of it. Do we have any other community members that have any other questions? Oh, we have Rebecca.
Hi, thank you so much, Kenda. That was a great presentation. I really enjoyed learning about birth and color. I have two questions. One is, do you think that there, I guess, is a space, or would you find it valuable, for example, like, does your team need a researcher? Can you imagine, I guess, a kind of a joint partnership with a university or a researcher that, rather than already got the grant and said, like, this is my agenda, came in and said, I have no agenda, could you all put me to work? You know what I mean? Like, you tell me what needs to be done. What does your organization need for that kind of collaboration? That's, I guess, my first question.
So sure. Yes, great question. So yes, we do accept that. So we do want people to reach out to us prior to writing or anything like that, or just to ask us like, hey, tell us your view. We do have, so we take researchers from all over, but we do have a specific partnership with VCU, which is a set team at VCU. So when I say that, don't feel like I work with the whole VCU. I found some individuals that really love the work that we do, and they won't put in any grant without our approval. And actually, it's every grant that they put in is based upon what we already have existing or what we can like contribute and add on to something else.
Thank you so much. That makes a lot of sense. And then my other question was just if you have any, I guess, partnerships or connections with any other reproductive justice organization. I know that there's many. I'm from Ohio, for example, and there's Root in Columbus. And I was just wondering if there's kind of connections, or if you like learn across different experiences from different states, anything like that.
Sure. Yes. So I'm actually on the steering committee of the Southern Reproductive Justice Collaborative. And so that's a lot of different organizations that's from the South that are doing the RJ work. When it comes to certain partners, we do have like national partners as well, like in our own voice. We are one of their state strategic partners. We do work with people like Planned Parenthood, Repro Rising, different people like that we also do work with. So we're always constantly like building, and we're all on calls together trying to figure out what is the landscape, how can we each help each other out. And so soon y'all will see some flyers. Well, I'm not sure, depending on where you live. There is a big joy and reproductive justice events that are gonna start circle around. So I think it starts September 28th. That'll be going to each a couple of different states.
Thank you so much.
Do you have any other questions from community or students? Your time hasn't passed either. We have one in the chat, Birth in Color sibling support.
So we have a sibling class where we teach siblings how to, well, we teach children how to be siblings, but that's as far as we go.
So you're ready to interrupt me if you see any more questions, but I think this has been a great session, a provocative and succinct presentation, and lots of great participation from the audience. And it sounds like you can expect to be contacted by some of these people, Kenda, about possibly research or volunteer or training. So a very productive session from a number of standpoints. I want to take a moment at the end of this to suggest to audience members, if you have people that you would like to see give seminars here, send along your suggestions. We're close to booked up for this semester, and I can't promise that we will be able to get anybody you suggest, or that we will feel that it'll fit into our series. But I always do ask for suggestions, and you can reach me at the email I'm typing into chat. So again, thank you on behalf of the program and Adrian Fu Berman and myself, and we'll see you all next week. Thanks again, Kenda. A pleasure having you here today.
Thank you so much.
Thank you all. Bye.